Before we begin, we invite you to subscribe to our channel and hit the notification bell for more insightful content. They say laughter is the best medicine, but some topics call for a different kind of conversation. Abortion, often whispered in hushed tones and shrouded in controversy, deserves our full attention, not a nervous giggle. It's a deeply personal decision, one with far-reaching implications for women and families across the globe. Before we dive into the specifics, let's be clear. This isn't about taking sides. This is about understanding. Understanding the procedures, the options, the realities faced by women navigating this complex landscape. Are you ready to move past the stigma and engage in an open, honest exploration of abortion procedures? Let's begin. This journey isn't about judgment. It's about knowledge. It's about empowering individuals to make informed decisions about their bodies and their lives. So let's embark on this journey together, with open minds and a commitment to understanding. Surgical abortion. The very phrase evokes sterile images of operating rooms and masked surgeons. But what does it really entail? Surgical abortion, as the name suggests, involves a surgical procedure to terminate a pregnancy. It's typically performed in a clinic or hospital setting and requires a trained medical professional. But hold on, surgical abortion isn't a one-size-fits-all term. It encompasses various methods, each with its own nuances. Two of the most common surgical abortion procedures are aspiration and dilation and evacuation, or D&E. Aspiration, often used in early pregnancy, involves using gentle suction to remove the pregnancy tissue. D&E, typically employed in later stages, combines dilation of the cervix with the use of instruments to remove the pregnancy. Take a moment to process these procedures. What comes to mind when you picture these methods? How do you think the stage of pregnancy might influence the choice of procedure? Now let's step out of the operating room and into the realm of medication. Medical abortion, often referred to as the abortion pill, offers a non-surgical alternative. But don't let the term pill mislead you. It's not as simple as popping an aspirin. Medical abortion typically involves a combination of two medications, mifepristone and misoprostol. Mifepristone works by blocking the hormone progesterone, essential for a pregnancy to continue. Misoprostol, taken a day or two later, causes the uterus to contract and expel the pregnancy tissue. This method is generally an option for pregnancies up to a certain gestational age, often around 10 weeks, though this can vary. It's crucial to consult a healthcare provider to determine if medical abortion is a suitable option for an individual's specific situation. Think about the implications of a non-surgical approach. How might this impact a woman's experience, both physically and emotionally? While aspiration, D&E, and medical abortion are the most widely known methods, it's essential to acknowledge that the spectrum of abortion procedures extends further. Less commonly utilized methods, such as induction abortion and hysterectomy, exist to address specific circumstances. Induction abortion involves using medications to induce labor and deliver the pregnancy. This method is typically reserved for later pregnancies or situations where other methods might not be medically advisable. Hysterectomy, a surgical procedure involving an incision in the abdomen and uterus, is rarely performed for abortion. It's typically considered when other methods are not feasible or in cases of significant medical complications. The existence of these less common methods highlights the complexity of abortion care. It underscores the need for individualized medical guidance and emphasizes that a one-size-fits-all approach is insufficient. Pause for a moment and consider the situations where these less common procedures might be necessary. What factors might influence a medical professional's decision to recommend these methods. Section 5. Aspiration versus dilation and evacuation. Weighing the options. We've touched upon aspiration and D&E, but let's delve deeper into the nuances of these two common surgical abortion procedures. Understanding the differences can be crucial for women facing this decision. Aspiration, often referred to as vacuum aspiration or suction curettage, is typically used in the first trimester, up to around 14 weeks of pregnancy. It involves inserting a thin tube into the uterus through the cervix and using gentle suction to remove the pregnancy tissue. D&E, on the other hand, is generally employed in the second trimester, from around 14 to 24 weeks of pregnancy. This procedure involves dilating the cervix more widely than in aspiration and using instruments alongside suction to remove the pregnancy. The choice between aspiration and D&E depends on various factors, including the stage of pregnancy, the healthcare provider's expertise, and the patient's medical history. It's a decision best made in consultation with a qualified medical professional. Imagine yourself in the shoes of a woman facing this choice. What questions would you ask your doctor? What factors would weigh most heavily on your decision? For more information and support, visit our website or contact a healthcare professional today. Section 6. The abortion pill. A closer look at the process. We've established that medical abortion offers a non-surgical alternative, but let's break down the process step by step. Understanding the sequence of events can help demystify this option. The first step typically involves taking mifepristone orally. This medication blocks the hormone progesterone, which is necessary for the pregnancy to continue growing. It essentially disrupts the pregnancy's ability to thrive. The second step, usually taken 24 to 48 hours later, involves taking misoprostol. This medication causes the uterus to contract and expel the pregnancy tissue, similar to a miscarriage. Cramping and bleeding are common side effects as the body expels the pregnancy. It's important to note that medical abortion is not a single event, but rather a process that can take several days. Women opting for this method often experience bleeding and cramping that can be heavier than a typical period. Think about the accessibility of medical abortion. How might the option of a non-surgical procedure impact women in different geographic locations or with limited access to healthcare? Section 7. Induction and hysterectomy. When are these methods necessary? While less common, induction abortion and hysterectomy play crucial roles in specific circumstances, highlighting the complex landscape of abortion care. Understanding when these methods might be necessary sheds light on the full spectrum of options. Induction abortion, as the name suggests, involves inducing labor to terminate a pregnancy. This method is typically reserved for later pregnancies, often in the second or third trimester. It might be considered when other methods are not medically advisable, or in cases of fetal anomalies incompatible with life. Hysterectomy, a surgical procedure involving an incision in the abdomen and uterus, is rarely performed for abortion. It's typically considered in extreme cases, such as when other methods have failed, or in life-threatening situations. The decision to utilize these less common methods is never taken lightly. It is a decision made in consultation with medical professionals, considering the individual's medical history, the stage of pregnancy, and other relevant factors. Take a moment to reflect on the gravity of these situations. How might the need for these less common procedures impact a woman's emotional and psychological well-being? Section 8. Your thoughts matter. Engaging in open dialogue. We've traversed the landscape of abortion procedures, exploring surgical and medical options, common and less common methods. But this journey isn't just about absorbing information, it's about sparking dialogue, encouraging reflection, and fostering understanding. What are your initial reactions to this information? Were you aware of the variety of abortion procedures available? How has this knowledge shaped your perspective on this complex issue? Open and honest conversations about abortion, free from judgment and stigma, are crucial. Sharing information, listening to different viewpoints, and engaging in respectful dialogue can help bridge divides and foster empathy. Section 9. Understanding abortion. A step towards informed choices. Our exploration of abortion procedures, from the familiar to the less common, underscores a crucial point. Informed decision-making is paramount. Understanding the options, the risks, the benefits, and the implications is essential for women facing this deeply personal choice. Knowledge is power. When individuals are equipped with accurate information, they can engage in meaningful conversations with their healthcare providers, make choices that align with their values, and navigate this complex landscape with greater confidence. This journey of understanding isn't about advocating for or against abortion. It's about equipping individuals with the knowledge to engage in informed discussions, make choices that align with their circumstances, and navigate this sensitive topic with greater clarity. Section 10. Stay tuned. Abortion safety. What you need to know. Our exploration of abortion procedures has provided a foundation for understanding this complex issue. But the conversation doesn't end there. The next crucial chapter focuses on a topic of paramount importance: abortion safety. Join us as we delve into the critical aspects of abortion safety, exploring the factors that contribute to safe procedures, addressing potential risks and complications, and emphasizing the importance of quality care. Your health and well-being are paramount, and making informed decisions requires a comprehensive understanding of safety considerations. Stay tuned for our next piece, Abortion Safety, What You Need to Know. Let's continue this journey of knowledge and empowerment together. For more information and resources, visit our website and subscribe to our channel. Stay informed, stay empowered.